My name is Cindy Key, and I want to help y'all to understand our insurance benefits. I think a lot of people are going to be upset when they realize what's going on, and so I wanted to try to talk to everybody and explain the differences in what's going on and what's going to take place. One thing that's going to happen this year is the button ain't going to work. In your guides, you should have gotten them, and in them you should see that effective January the 1st, you're going to all get new insurance cards. Everybody's going to get a new insurance card because the copays, your deductible, and your emergency room fees have gone up. So in that case, everybody had to get a new card. Now, when you get your new card, please destroy the old one come January 1. Don't destroy your new one, destroy your old one. There's going to be an increase in the health and the dental. So today I want to show you some ways to save you some money to hopefully help you get through this transition without it devastating you. Now, our out-of-network, that's a big deal. Out-of-network means that I am going to a hospital or a doctor that does not take Cigna. That's out-of-network. I don't just have any Cigna. I have Cigna Access Plus. So when I go on to Cigna's website, I have to click on Cigna Access Plus. I don't just have any Blue Cross. I have Blue Cross S, as in state. So if I want to know if the provider is in our network, I've got to look on those two plans. If I just look on Blue Cross's network, they might be on there. But if they're not in Blue Cross S, then they're not one of their providers. Now, another way to stay in network, and this is so important. If I live beside Skyline Hospital, they are not in Blue Cross, and I choose to go there, then they're out of network. But if I choose Cigna, all the HCA hospitals are in there, so if I were on the Cigna plan, I'm in network. That's a real, and you have questions, stop me. You have one, Santiago?
Well, you said, but if it wasn't Cigna Access Plus, would that be under that umbrella?
The Cigna Access Plus has all the HCA hospitals. It has all, that's good. Ask questions, that's how we learn. Okay, you got one?
In an emergency situation.
Right.
Paramedics goes to the nearest hospital.
Exactly. And in that case, they will take you to the nearest hospital and it will pay, but once they get you stabilized, they're going to move you to an in-network hospital. We had that happen to one of our employees. She went into Walgreens and had some kind of seizure. They called an ambulance. They took her to the nearest hospital, out of network. Once they got her stabilized and got her where she could go home, she got a bill in the mail for $5,000. She called me crying, and I said, whoa, it's okay. We filed an appeal, and they paid it. Because you can't control where the ambulance takes you. But if you know you live beside the hospital or in that area, that's where they're going to take you. If you break, I'll get you in just a second. If you break your arm, or if one of your children breaks an arm, that's not a life-threatening emergency. So we have to think about that. If it's not a life-threatening emergency, you need to go to an in-network hospital or doctor. Let me get Pam's question. Pam?
What if your doctor's at the hospital?
Okay, that happens a lot. People say, well, my doctor's in Centennial and he takes Blue Cross. That's fine, but that hospital's still not in there. And you can use those doctors, but you cannot use their facilities. So what you would have to do, like myself, say, he said, Cindy, I want you to go get an MRI. Now, working in insurance like I do, I know what I'm going to do. I'm going to call the number on the back of my insurance card, and wherever they're referring me to, I'm going to check to make sure that I can go there. And a lot of times they'll say, oh, I know they're covered. I know they'll cover that. Don't do that because they don't know that. These providers get in and out whenever they want to. So if I were you and they were sending me somewhere to have tests done, I'd call the 1-800 number on the back of my insurance card while I was standing there and find out. It's really important, guys. It doubles your deductible. You pay 40% out of your pocket instead of 10% if you get out of network. It's very expensive to you. Now, Pam, did I answer your question? Did that answer it? Okay.
As far as like Baptist Hospital and Vanderbilt and St. Thomas, are those all in network?
They're in both of them. In the Blue Cross plan, you really need to go to their website. But in the Blue Cross plan, to my knowledge, Vanderbilt's Children's Hospital, St. Thomas, and Baptist are in those plans in the Middle Tennessee area. In the Middle Tennessee area, Cigna, almost all hospitals are in that plan. They just couldn't negotiate out a price. So that's why that happened. So what you need to do is each individual has to choose what works for them. Now, I'll be honest with you, the premiums went up. Okay, I was paying $20 a month extra for Cigna, and I was okay with that because I live out in the boonies. Everybody knows me, knows I live in the boonies. I have friends that tell me I have to pipe in sunshine. So what I do, I looked at it, I thought, with the increase in the premiums, which are on page, what page are they on? I think 6 or 7. They're on page 10 and 11 of this book. So I sit there and I looked at it. And I thought, well, now what can I do to cut my cost? This is what I'm going to do. Y'all might not want to do this, but this is what I'm going to do. I'm going to go on the Blue Cross plan because I use Vanderbilt's Children's Hospital for my kids, and I use St. Thomas for me. The hospital where I live at, we call it Good Luck. So I don't want to stop there. So instead of going there, David, I think I'll go on to St. Thomas. So I know that. And if something were happening and it was life-threatening, I could go to the hospital nearest me and it would pay until they could get me stable. But if one of my kids breaks their arm or does something like that, we're going to Vanderbilt's Children's Hospital because it's what? In network.
You mentioned that the premiums increase, and I observed that they increased almost 26% for Cigna. What's driving the increase in that, and how much?
Negotiations. These vendors negotiate with these doctors and hospitals. That's what drives it.
I know the consumer price index for medical care in the past 12 months only went up 4.2%.
But we are self-insured. And what that means is we have to keep a pot that will pay benefits for everybody who works for the state, all their dependents, and all the teachers, everybody that's on the state plans and the counties. Okay, I was in Chattanooga the other day, and someone said, well, I go to the emergency room all the time. Do you know what it costs to go to the emergency room versus the $45 copay? If you go to the emergency room now and they don't keep you, it costs you $125 in the partnership plan. It's going to cost you $145 in the standard plan. We have driven the cost of insurance up ourselves by not managing our health. That's what's done it. We haven't managed our health.
What happens if you're out of state?
If you're out of state, go to wherever. If you're out of state, go to wherever. So when you get your new cards, you're going to see a specialist. Copay has gone up $5. And as I just told you, the emergency room went up $45, so now it's $125 and $145. Now, I don't know about y'all, but I can't afford that. I'll tell you how tight I am. I always tell on me. When I had my hand crushed, and I had to have surgery twice on my hand, I wouldn't go to the emergency room. It happened like 11 o'clock at night. I waited till the next morning, went to my doctor. I survived it. You know, you have to learn to manage things. And if we learn to manage things and to manage these programs, I'm telling you, it will work. Now, the increase in the pharmacy copays is going up by $5. Does anyone in here use the 90-day plan? Does anyone in here not understand the 90-day plan? Okay. Let me minimize this one. Myself, I always use me. I take maintenance drugs, and I pay $120 for all my medicine 4 times a year, because I get 90-day plan. If I did this every month, I would have to pay that every month, $120. And if I did that for 12 months, I would pay $1,240. But if I do it every 90 days, I pay $480. So if I know that I'm getting the same prescription every month, I need to do that on a 90-day plan. The CVS pharmacies do 90-day plans. Kroger does 90-day plans, and so does Walmart. Did you have a question? To CVS. You can also do mail-in. A lot of people do mail-in, but if you're not there to get your medicine, be careful. You know, people do tend to take things out of the mailboxes. So what I would do if I were you, I would find me a place to do the 90-day plan, because it'll save you. Walgreens won't do 90-day. Not for us. And the reason being, they're in competition with CVS. So they'll do 30 days, but not 90. So maybe your doctors wrote the prescription wrong, Vivian. Might check that and see. I guess it's according to what you take. But myself, I have my 90 days filled at a CVS pharmacy. And then I do my 30 days wherever I want to. That's within what? Network. Stay within the network, guys. Stay within the network.
Cindy, can I ask another quick question?
Uh-huh.
On some drugs you can't get 90 days just because the drug.
Right.
They don't,
So then you'd have to do that under the 30-day plan.
Well, you can do it under the mail-in. The mail, Caremark uses UPS
Uh-huh.
for scheduled medicines.
Uh-huh.
Do you know if there's a way to communicate with them and maybe whether UPS use postal service, because it still requires a signature. But if you're not there for UPS, you have to go find a UPS.
No, they will not change that.
Okay.
They will not. So we have to realize what's going on and try to save money. Now, I know we have men and women in here right now, but women's contraceptives, they are considered a wellness, so you don't have to pay your copay on that anymore. That's a new thing. Now, closing enrollment in the Universal Life. A lot of us in this room have few-year service, and we have Universal Life with Provident. You still have Universal Life, but we're going to change vendors. It's not going to be with Provident any longer. And so, you know, every year you can up it $5. Can't do it this year. You're going to have to wait until March, and then we're going to have our new vendor, and then you'll be able to do this. So this year you will not be able to do that. So you can't contact our office or Uniprovident and ask them why you didn't get a letter, because that's why. And it's a big change for everybody because we've had Uniprovident for years.
What do you mean up at $5?
5,000. 5,000. Like if I had 100,000 and my salary allowed me 5,000 more, they'd send it to me.
Okay.
Now, I love this one. We got a new vision plan. Yay! I'm excited about that. And the new vision plan is on page 15 and 16 of the booklet. You have a basic plan and you have the expanded plan. Myself, I like the expanded plan because it pays more. For me and my children, I'm only going to have to pay $11.46 to cover 5 people. That's not bad. And everybody in our house wears glasses but one. So I'm excited. It's going to pay $115 towards your frames. It's going to pay, you're going to have a $10 copay for your eye exam. You're going to get so much towards the bifocals, and then everything after it gets through paying what it pays, and say I owed $100, it's going to pay 20% of the $100. So then I would only owe $80. There's no pre-existing, and it's effective January the 1st. Uh-huh. Go ahead.
If you have a specialist, you still have to pay, you wouldn't pay $10 for that then, would you?
If they're in their network. It's got to be in your network. Now, a lot of people have medical issues and they have to use their health insurance for their eyes. That's still in effect, and you would still do that. But the vision would come in and help you buy the frames and the lenses and those sort of things. What was your question?
Can you go anywhere, or is it specific?
No, they have a network. They have a network, and you would have to go into the network that they have. And it's on here. Their network is. And then you'll be able to look and see. But I'm excited about the vision because we hadn't had that in a long time. Any questions?
Those network providers, are those
They'll be on their website. But when I went to the class, it said Sears Optical, JCPenney Optical, Lens Crafters. I forgot the other one. Target Optical. So those are 4 main ones I know of that are in there. And there might be some more, but Walmart is not in there. I do know that. Now here's something most people are not going to like. We've changed our wellness partners, and come January the 1st, our new wellness people are going to be Health Ways. So that's www.healthways.com. Now, come January the 1st through March the 15th, remember that date, March the 15th, you have to have your questionnaire done. You have to have gone online, went through the prompts, and done your questionnaire. If you have a spouse, they have to do it also. Now, if you're on the standard plan, you don't have to do it. But if you're on the partnership plan, you have to do it. Let's talk about that. Well, I'll just jump on the partnership plan, and I won't have to be bothered, okay? Your deductible doubles. Your co-insurance goes from 10% to 40%, and your co-pays are higher, and your premium is higher. So unless you're working for the state and you got somebody giving you more money than the rest of us, it's going to be very expensive to do that. But if you do not complete your questionnaire by when? March the 15th. You could be very well kicked on to that standard plan. So this is a date I want you to remember. Questionnaire by March 15th.
What's the difference? The standard plan and the in-network plan, what's the difference? What's the standard plan?
The standard plan says I do not have to work with my wellness coach. The standard plan says I pay higher premiums, I pay higher deductibles, I pay higher copays, so that you do not have to have a health coach call me. That's what the standard plan does. And the partnership plan says, I am going to try to get healthy. Now, for some strange reason, they think I'm fat. Can you imagine? I told them, they said, are you doing anything about this? I said, well, I've moved further away from the refrigerator. That's about the truth, too. I got those kids, they make fun of me. So this morning I got on my bike. I did do something healthy this morning. But seriously, that's what the health coach does. The health coach tries to get us healthy. And I will tell you this, since I quit diagnosing myself and started doing what they told me, I'm doing better. I haven't had an asthma attack in 2 years, except, take that back, on the second floor someone had a lot of cologne, and I got in that, and I had one then. But it was brought on by that cologne. It wasn't brought on by not doing what I'm supposed to. After a couple of days, I got better, and I ain't had another one. But see, that's what the health coach does. Then I was somewhere, I've been all over the state, and someone said, well, they call me all the time. I said, well, then you need to start doing what you're supposed to. You know, like that, teasing. But I guess what they're trying to do is keep us healthy. I don't know about y'all, but I do a nursing home ministry once a month, and it's sad when you go in there. If you don't want to do the partnership plan and stay healthy, go to the nursing home, take a visit. It's sad. It's really sad. It's one place I do not want to end up. I'm going to try my best to ride that bike and stay out of that refrigerator. And then another thing is, a lot of people say, I'm not using generic drugs. Okay? This year, if you decide you do not want to use a generic drug and your doctor says can use generic drugs on the prescription, then you're going to pay the difference that your insurance pays plus the difference in that copay. That could be a lot of money. So you really need to think about that one. Now, a lot of medicines don't have generic. Like my Advair doesn't have generic, so I don't have to take it. But if they come out with one, I'll have to take it. That's another thing that's new this year.
Unless your doctor writes specifically.
No generics. Now, the vision will start on January. And here is the website. If you want to go out and check and see who their vendors are, and where you can go, and what doctors, imedvisioncare.com.